afternoon, everyone. It's Cathy Mellett here, coming to you from I'm Enough, and today I'm with Dr. Sanjay Govind, and we're just talking about what Sanjay sees in day-to-day general health practice around the youth, around digital, around how young people are presenting themselves today. So Sanjay, in terms of people that come to see you, how are they presenting, and what are the things that you're seeing as a pattern through the younger people as they come to see you?
Thanks, Cathy. My name is Sanjay Govind. I'm a urgent care physician, and I tend to see patients coming through in an acute stage. Those that have been directly or indirectly affected by some sort of anxiety or stress, a turning point that has led them to come to see me rather than their GP, who usually knows them relatively well. What we're noticing a pattern is patients that are engrossed in their digital media, that are now noticing they're being judged, they're being looked at, they're being and offered an opinion about their picture, their surroundings, their holidays, which don't seem to be in keeping with what they perceive themselves as. And this then sort of adversely affects them in the fact that they feel that they're not part of the peer group that would be associated with having these digital media applications.
Sanjay, would you almost say that there's also a level that you're seeing of although they feel like they're not part, does that lead to them feeling very isolated? So they may have lots of Facebook friends or lots of Instagram friends or lots of Snapchat connections, but at the end of the day, they're actually starting to feel quite isolated.
That we're seeing quite a bit of that component to it. So even though they may have tons and tons of followers, or they may be following tons of people, yet they start to feel that they're becoming isolated in the bigger scheme of things. And this then starts to impact on their health, developing an anxiety, depression, and sometimes to the point where they tend to become suicidal or parasuicidal. This is so backtracking, and in consultations, the source of their issues lies from the mere fact that their perception of how they are seen on digital media itself. And the isolation then starts to manifest itself in not taking care of themselves, depressed moods, isolating themselves in their rooms and not venturing out, becoming focused and addicted to wanting more and more so-called likes on their sites so as to improve their self-worth and self-being.
And so if you take that, when they present with you, obviously there's levels of medication that can be looked at to facilitate where they are at that point in time. But if we could roll back the clock and we could go back to a point in time and say, what do you think somebody could do if they feel they're going down a path that is making them low of mood, or they feel like they're judging themselves by how they perceive their friends? Do you have any tips, maybe as a professional person, but also as a a connection, a family man, etc., that you could see them taking on board and doing to change that?
Absolutely, Cathy. If one looks at possibly stepping back from the source of the digital media that's creating the environment, one would say, how about stepping back for not engaging with that for a 24, 36, 48-hour period? Seeing that one can do without having to have the number of likes that what one would want and expect. Seeing if that makes you feel any better in any way, and does it contribute towards the way you start to feel? I'm of the personal belief that I think that these applications are well formatted so that they make you addictive enough to want to keep going back to seeing what your friends are doing, what your family members may be doing, how much better someone else's life might be. The unfortunate thing is these applications always seem to portray everyone in a good light, i.e. meaning that they're always living in the good life, they're enjoying the benefits and the fruits of the world itself, and never the true scenarios that go with what life's about, the hardships that go with it, the day-to-day toil of every man in this world. But what we tend to see are the good life, and that's what makes one start to wonder about their own lives. Why are they not enjoying the benefits of their friends and family who are on holiday or on a yacht, or, for example, flying to exotic destinations? And this is all that's seen as a perceived component rather than the reality of what's going on.
And I think that was one of the other professionals that spoke about, is the ability to look at what you're judging yourself by, and to actually question how real is that judgment, because whilst you're looking at the person's Facebook page, which is the cover of the book, you don't know what's going on in the book. So maybe, and I don't mean to put words in your mouth, perhaps that's the thought, is about really assessing what you're judging yourself against. So what I'm hearing is, one, assess, but two, also take a step back.
Absolutely. Probably the best way to be able to judge what people do from a day-to-day basis is just look around you. Those are the people that are real, that you're not seeing a digitalized picture, you're not seeing a Photoshop picture, and you're not seeing a picture in an exotic place. You're seeing your friends, your family, they get up, go to work, go to school, enjoy a day's work, and then come back home, and that's their lives. And that is the reality of the situation for a vast majority of us. So trying to judge someone who's living somewhere else, who's got an exotic holiday or an exotic lifestyle, is not what we all will be able to enjoy, but we can always strive towards.
Cool. And Sanjay, before we end off the session, perhaps a question to you. If somebody is in a room, if somebody is potentially depressed, if somebody is anxious, there are organisations that they can turn to. What do you suggest? Absolutely.
There are a multitude of organisations that are out there at the moment that can help. And our first thing we would start off is with, go and see your family doctor. If you can't get to see your family doctor, there are several urgent care practices around the country itself. Go and see an urgent care doctor. If not, there is the helpline. Contact the helpline. And if you Google the crisis team will be able to access, you'll be able to access the help of the crisis team as well. So there is tons of help out there. Please access it.
Absolutely. Well, Sanjay, thank you very much for your time today, and thank you for coming on board with I'm Enough and to deliver some of your expert advice.
Thanks
very
much,
Sanjay.
It's good.